You could click your tongue up all you want, but if you have a tongue tie that's impacting your ability for your tongue to rest correctly on the roof of the mouth, then it's never going to carry over unconsciously when you're sleeping. A restricted lingual frenum or a tongue tie, it's one of the most, if not the number one most significant contributing factor to tongue dysfunction from a myofunctional perspective. Why is that? Well, that tissue develops in utero. So when the baby's born, they're born that way. And that tissue is not elastic. It does not stretch or grow longer. Some people might think it does. It does not. It's not an elastic tissue. So that can pull the tongue down. Now, if someone has like an anterior tongue tie, anybody would recognize that. Any person would say, "What's the tongue is stuck, right? The tip of the
Front
tongue,
of the tongue.
front,
Yeah.
anterior,
Yeah.
front of the tongue, right?" Most people will catch that even in infancy, but I'm going to tell you, we get patients where you're just like boggled that nobody told them their tongue is stuck at the front, and they have a lot of orthodontic problems and eating problems and speech issues potentially. But I don't know, have you heard of the word posterior tongue tie?
I have. Yeah. Mm-hmm.
It can
Mm-hmm.
confuse people a lot, and we don't need to go into super detail about it, but we talked about tongue posture, front, middle, back needs to be sucked up. Well, sometimes the tip of the tongue is not tethered down, but the middle and the back of the tongue are pulled down from the tongue tie.
How can we test for that in ourselves?
So that's where a myofunctional therapist will evaluate for that, or someone who has training. There's specific protocols of how to evaluate for tongue tie. And some dentists or orthodontists or pediatricians, ear, nose, and throat doctors will miss that. Because if you're not trained in how to assess for how it's affecting functioning and rest posture, then you might miss that. So there's a specific protocol. So we'll have a patient open their mouth.
Could Nicole, could we maybe like evaluate me for that, just as an example? Would you be comfortable
Yeah,
doing
and have
that?
you ever had a tongue tie release before?
I did. I had a tongue tie release in 2017. Not sure. I think I had a good result, but I by no means think I have a perfectly released tongue, because I know that when the uh, TRMR, my
Yeah, well, that's what I was going
TRMR
to say. Mhm.
is probably, I don't know, you can tell me, but I would say it's like 70%. So I know my tongue is by no means perfect.
Mhm.
But as far as my posterior tongue tethering, that's where I'm a lot less clear, because I know that my release was definitely right up front with the laser, and that nothing was really done on the back sides.
So it's not the back sides. So what can be
Okay.
confusing is
Hmm.
when you think of posterior, you might think like way back. It's still the front, not the side. So we all have that string of tissue. I have my tongue tie release. And it can be laser, it can be scissors. It's not the tool, but more the technique of the provider to know to release back enough. So not just like a little snip in the front, but you want to release it enough. So that string of tissue far enough back where it's going to allow the middle and the back of the tongue to go up. And we'll look at yours in a second.
Sure.
But what we do is we never refer for a tongue tie release right off the bat if the tissue appears to be short or tight. We always have to do myofunctional therapy exercises first to strengthen and tone the muscles so they're prepared for a release. And then we do rehabilitation after. So it's very rare or atypical to ever say like you have a tongue tie, or if a dentist notices that, and just to release it, because the goal of releasing it is to get correct oral rest posture and chewing and swallowing. It's not like a means to an end procedure. So it needs work before and work after. So we use the TRMR as one factor to evaluate. We don't really care on tongue protrusion. So like sticking the tongue out. A dentist might care on like range of motion to clean the back teeth, things like that. But what we
Mm.
care about is, can the middle and back portions of the tongue rest sucked up easily? So I might have a patient stick the tongue out. So you might go ahead and stick your tongue out. You might have to come closer to the screen too so I can see it really well. But I'm gonna have you stick your tongue and try to stick out and not have it touch your teeth. Okay, good. And then you can bring it back in and relax. And I might have you come like really close to the screen to help me see it better. But what I might look for is there a dip, like a cup or a bowl shape in the front or middle of the tongue when you stick it out? If there is, that my brain starts thinking, okay, there is something underneath the tongue pulling it. If not, it doesn't matter. If there's a heart shape in the front of the tongue, that's usually it's restricted. You don't have that.